Good afternoon, and thank you for joining us. I'm Bridget Anderson, the President and CEO of the Greater Vancouver Board of Trade, and welcome to our Business Resiliency series, Navigating COVID-19. Today, we will focus on how business can play a part in supporting healthcare workers during this pandemic. In this time of unprecedented uncertainty, we want to ensure our members and the broader business community can find answers to their most pressing questions. Through a series of free webinars, experts will provide guidance and answer questions to help companies navigate the next step. We encourage you to take part in this discussion. You can engage with us on Twitter, Facebook, and Instagram by using the hashtag GVBOT. And we are also using Slido for today's discussion to allow you to take part. Go to slido.com and enter the code GVBOT nurses. Now, before we start, and especially in these challenging times, we want to thank our long-standing sponsors called our Pillar Partners. They include TELUS, CN, YVR, BCIT, and Air Canada. We are very grateful for the support of these 5 organizations whose annual partnerships and commitments enable the work of the Board of Trade. Thank you as well to our preferred media partner, Business in Vancouver. Today, we are joined by Christine Sorensen, the president of the BC Nurses Union. Christine graduated from the UBC School of Nursing. Her public health career returned her to Kamloops, where she was elected chair of BCNU's Thompson North Okanagan region in 2010. She was elected vice president of the union in 2012 and president in 2018. Christine, it's nice to see you. Thanks for joining us. I'm going to hand it over to you for a couple of minutes for some remarks, and then we will open it up to questions. Over to you.
Thank you very much, Bridget. It's wonderful to be here with you today, certainly as a member of the Vancouver Board of Trade. I have spoken before about how important healthcare really is to the business community, and if there's ever a time that we found that out, this is it. It's very much, as you said, an unprecedented time. But for those of us in healthcare, and particularly for me, who has worked in public health for the majority of my career, it's not something that we didn't expect. We've been preparing for a pandemic since the 1918 pandemic, and we've had little tastes, shall we say, little experiences in the past between our episode of SARS, which we saw high death rates, particularly in Ontario, H1N1, MERS in the Mediterranean area. We also have seen issues around Zika virus more recently, or Ebola. And so we've been anticipating that at some point we would have a pandemic. Of course, I think there was always the belief that, we're not in 1918 anymore. We have lots of very good experience with managing outbreaks. We have a much more robust healthcare system. And fortunately, in this country, we have a very good public healthcare system. And for that reason, I think there was the belief that we would be able to manage this well. I am grateful to say, though, that there are a lot of things we have done very well during this pandemic, and I think BC is showing that. Some of the efforts put in place very early on under the direction of our medical health officer really showed that if we work together quickly, put in control measures, social distancing, physical distancing measures very quickly, we've been able to manage the numbers of people who have been infected with this disease, as well as those who've been seriously ill with it and then required care in hospital or ICU. This, of course, comes with significant impact on everyone in society, including those of us that work in healthcare, and the changes to our normal day and course of business as we moved people out of hospitals, as we opened up beds, as we stopped surgery. And also myself as an employer. We employ 180 people who work for the BC Nurses Union across the province, and how very quickly, and it was 4 weeks today, we implemented working from home measures. So it has been, transformational for all of us and challenging at times. Right now, we're in a time period where it seems we've done the right thing in BC and we're able to manage, but it isn't the time to take the steps, relax those steps. We need to stay consistent with our approach. This has obviously significant impact for all of us, because the biggest question is, when do we get to come out of this? When do we get to end these control measures? And there's been, from the nurses' perspective, an enormous amount of support from the community, and we're incredibly grateful. Every day, those 7 p.m. cheers that, warm our hearts and make us remember that we're not in it alone. We're working in collaboration with the other 5 million people in this province, trying to bend that curve down, keep the numbers low, reduce the number of people who are seriously injured. And we're grateful for the numbers of people in the business community who've stepped forward to support healthcare workers in a number of times when they've asked for support from the community, whether that's been from parking issues or accommodations, to lately our significant concern about personal protective equipment. And we've decided that it's really important as an organization that we show appreciation back to our community by supporting things that are important to us as healthcare providers and recognize the needs of so many of our people in our community. So through the Vancouver Foundation, the BCNU has created a fund where we have donated money that goes to support our BC food banks, another organization that are supporting the numbers of people across BC who are now out of work, facing financial difficulties and needing support. And as nurses, you know, it's really important. We really do care for all, whether they're in the acute care system, in community, in long-term care, or those people who haven't entered our healthcare system yet, who may be struggling right now. And some of those people, Bridget, may be some of the people who work in the businesses that are represented by the Vancouver Board of Trade as they struggle to manage their business in this time of closure. So thank you, Bridget.
Thanks very much, Christine. I really appreciate some of your comments there and an overview of what some of your sector has been dealing with. You know, this series, the Business Resiliency series, has focused a lot on what the needs of the business community has been in this time of crisis, whether that has been addressing lease payments or whether it's been around financial measures, around the wage subsidy. So there has been a lot of learning coming out of this crisis time as we're starting slowly to pivot to thinking about the recovery stage. So from your perspective then, what are some of the learnings that have come out of this pandemic that businesses can put into action when they are reviewing and updating their business continuity plans?
Well, I think one of the things we've all learned very quickly is we can scale up. We can scale up very quickly if we need to, particularly when there's a crisis, or we can scale down, meaning we can make significant change to protect the health and well-being of the population. As a business myself, we have seen the need to figure out how to work from home and the utilization of technology to transform that type of work that we do so that we can support the 48,000 members that we represent in about 700 work sites across the province. So we have our staff working from home, supporting all of these members. The other thing that was really important that we did was open up a phone line, a 24/7 contact point where our members, our 48,000 members, could reach out and get questions answered. The other thing also from a technology or social media perspective is we had to provide information very quickly out to our members, real-time, up-to-date information as quickly as we can. And so certainly our communications team has been extremely busy, particularly over the last 4 weeks, getting that information out to the people that we connect with regularly on a daily basis. And then certainly as we move through this time, and within healthcare, they too have scaled up. They have scaled up and transformed their business by moving patients out of acute care facilities, moving them into other places, transforming teams, redeploying people to other work sites, scaling up and providing more information and education for select groups of people who had to do different work now, particularly nurses who worked on a medical surgical unit, who are now being asked to work in a high acuity unit or in an ICU to take care of patients that might require ventilation. And so nurses very quickly, as the business community, have had to transform how they do work in the business they do. We've also seen a reliance on needing to move people out into the community and to do our work differently in a different place, moving back to community where we can care for people in their own homes. And we've also identified areas where there's been really big challenges, where we need to take a second hard look at how do we do business there, and what do we need to do differently. And that particular for us has been around our long-term care homes. And you've seen the government respond to that with significant policy changes and transforming the workforce in that area and increasing rates of pay to compensate those people who are working in that area.
Some great learnings there that are definitely applicable to all sectors, whether it is the priority on communication, the need to be clear, to be concise, to continually communicate. Your comments around redeploying resources and assets are really, really important as well. So as we make this pivot to recovery and we look towards public health officials giving us guidelines on some of those restrictions lifting, whenever that might be, what are some of the considerations that the business community needs to have in place when we get to that point?
I think that's a really important question because there will not be a cookie cutter approach. Every country seems to be tackling this differently. Every province will tackle this differently, and every worksite will need to tackle this differently. So I think there will be some key considerations. We will need a long period to continue to enact the social distancing, physical distancing, enhanced hygiene or cleaning measures. And so I think all of us will need to look at how do we manage starting our business up again? How do we bring our staff back? Will there be supports for them for childcare, for example? And if staff don't have childcare, are they able to come back? If transportation is an issue, how do we get them back into the workplace? When they do come into the workplace, how do we maintain those physical distancing measures? How do we maintain 6 feet between our employees? How do we ensure that we have enhanced cleaning and hand washing? What do we do when people get sick? And what if they're sick with COVID? What happens if we have to, and so we've often said, oh, it's okay if you have a bit of the sniffles, show up at work. I don't think that's going to be permissible anymore. People will need to stay home. So we need to look at how do we support people when they're ill. But if people test positive for COVID, and as we move through this disease, we will see more and more people test positive. And what will happen when we have to close a section of our business or perhaps close a whole division or a whole store as we are moving through? What will we do as measures release, but then when measures restrict again? And so we may not be doing business as usual for a very long time. And I know that there have been conversations around 12 to 18 months of release and contract restrictions. So really having to pay attention to a number of those things. And what kind of physical barriers can we put into place to assist with that, to ensure our own staff and the public that we're serving are both safe?
And you bring up a really good point, Christine, that we are going to be in a transition period for an unknown period of time, but perhaps for a longer period than maybe some people had originally anticipated. And so to ensure that that we are thinking about that and thinking about those measures, because there could very much be a second wave.
Well, I think that it's not only a second wave, it's a third wave, it's seasonal influence. Again, this is a novel coronavirus, novel meaning new. Well, we do understand some things around other illnesses like influenza, which we monitor all the time. Really, we've only started to study this from January on, and we're getting more information from China every day. But every day I'm hearing new information. And as we watch other countries who had very good control measures in place, like Singapore, relax those measures, and now they're starting to see increased numbers of cases. We will not be out of this until we have what's called herd immunity, 80% of the population infected and showing immunity, or a treatment or a vaccine. And in reality, that's a long way away, 12 to 18 months. And so that takes time. So we have to slowly allow the population to become infected so as to not overwhelm the healthcare system, and or certainly, hopefully, we see a vaccine sooner.
Let's go to some questions now from some of the viewers who are watching. And again, you can log on to slido.com and the password is GBBOT nurses. And you know, this was a question that was at the top of my mind as well around the personal protective equipment. So given there is a shortage, what is the healthcare system doing to protect healthcare workers and their families?
That's a very good question. You know, this has been something that has taken all of us a bit back, is the high use, high amount of personal protective equipment that is required. A lot of focus on the need for N95 masks. And I do see some really exciting things happening in the community. I believe one of the companies, Novo Textiles, is pivoting to move from making dog beds, I think, to N95 masks. So that's really exciting to see some things happening in the community to help us. In reality, N95 masks are only one piece of very important personal protective equipment from head to toe. And we are going to be in a period of time where we do not have the equipment that we need to safely care for the workers. And it will be some time before we're out of the PPE shortage. There are lots of things that are being done. PHSA, so the Provincial Health Services Association, has created shared services. So they are doing all of the ordering on behalf of the province. Over 3,000 companies have reached out to them. Unfortunately, not all of those companies meet the standards that are required for our healthcare workers. And while a lot of equipment comes forward, we do at the end of the day need to make sure that that equipment is safe and can be used by all of the healthcare workers to protect them and ensure that they don't contract the virus or transmit it in any way to somebody in the healthcare system. So it will be some time. Grateful, very grateful for places. Arc'teryx, I understand, is also making gowns for people, and a number of the hockey helmet companies are making new face masks. So it's been interesting to see companies pivot and try to help the healthcare system. So very grateful for that.
Absolutely, and Arc'teryx came to mind because they were just in the news recently, but other companies who are distillery companies, or distillers, I guess, making hand sanitizer. And so it is a good point that you make, though, that, you know, for many companies, they may be able to pivot, but can they meet the requirements? So certainly something for companies to look into when they are thinking about how they can pivot to ensure that they've got the right criteria in place.
Yeah, and I would say it's really important. I know people are focused on what they can help the healthcare system, but as we go through this for the next 12 to 18 months, hand sanitizer is a perfect example, not only required by the healthcare system, but absolutely required by all of us in the public. And increased cleaning supplies. I realized in my apartment the other day, they were all out of cleaning supplies. The stock had been sold out. And so important to realize additional cleaning supplies will be important as we move through this. And what will the public need?
A question here again about the primary needs of the healthcare system and healthcare workers. So what are those needs and what are the implications if those needs are not met? Recognizing the incredible burden on the healthcare workers in the system right now. And, you know, I think you mentioned at the 7 o'clock banging of the pots and pans and the honking of horns, a lot of people, including myself and my family, showing that kind of gratitude and support. But when we're thinking about primary needs, what is not being met, and what was the implication if that's not being met?
Right. That's a very good question. I get that from the public a lot. What more can we do besides the 7 p.m. shout out? And the public has really supported some of the asks that nurses have come forward with. We did talk about paid parking. That was an issue, nurses missing their parking. And so a number of parking companies came forward and released the parking fees, and then the government made that initiative. The next ask that came forward was the need for accommodation, as nurses were working extended hours or were concerned about going home and transmitting the virus to their families, so wanted a place to have a shower or to rest before they went home. And so a number of hotel chains came forward, and we now see more work around accommodation, providing accommodation for the public. You know, at the end of the day, nurses are struggling with even sometimes just getting to the grocery store because their shifts have been long and they can't get there. So wonderful to see people providing food for nurses, even dropping off something at their doorstep. Nurses have also wanted to give back, and that's why we did make the donation to the BC Food Bank Association, because, and I see that at Surrey Memorial Hospital, a large group of nurses there have contributed back nearly $8,000 to the food bank. We are really very concerned about the population in general. We see a lot of issues around mental health concerns. And so, you know, ways to give back to nurses are also reaching out and supporting other people in your community, checking in on them, making sure that they have what they need. And making sure that when you are sick, you do come to the hospital and you don't forget to come and see us, because we do need to see you if you really are unwell. But most importantly is continuing to follow those public health directives and those measures. It is so important that people follow those stay-at-home orders and minimal physical contact and distancing. That's what really warms the nurse's heart when we see people out in large crowds, out doing athletic activities, traveling or going to areas. We really question if people are in it with us.
We have seen catering companies and we've seen restaurants put together large packages of meals for healthcare workers. And so there's a question here about consistency and really goes back to that criteria as a business pivot. So what are some ways that this catering company can facilitate consistent meal services, and especially in long-term care facilities?
Yeah, that's been a very helpful thing for many of the nurses. Again, nurses are very conscientious of not transmitting disease, so they're concerned about bringing things in and out of healthcare facilities, so even their lunch. So having people drop that off, and again, many nurses working long hours, extended hours, don't even have time to go to their own grocery store and prepare. So we've really appreciated the support of the food industry and the catering companies who've done that for us. We'll also need to see how we manage in some of our long-term care facilities as their own food supply and food support services are stressed as people become ill, and we need additional supports that way. Certainly we'll be looking through that. Provincial Health Services Association will be working with the government on how to provide food services and make sure that healthcare workers are supported. And it isn't just healthcare workers, I remind you, that we're really in this with a team. It's a broad team, not only in acute care, but out in the community and essential service workers.
And long-term care facilities have been I think they've been impacted most significantly by this pandemic. So question here is what more can be done to support the long-term care facilities?
I think this will be a time for us to really pay close attention on how we can transform our long-term care facilities, not only here in BC, but across Canada. This has really shone a light on some of the challenges that have been raised in the past by our seniors advocate, Isabel McKenzie, in regards to staffing in long-term care facilities, in regards to even cleaning practices in our long-term care facilities, which is now becoming of concern, maintaining the supports that they need around personal protective equipment, and really understanding the acuity of and the complexity of some of the patients that are residing in our long-term care facility. I think we will see a lot of policy changes coming forward. I'm pleased to see the change around staffing to single site staffing. This will really transform how we do staffing in this province and full-time equivalent positions instead of part-time positions in a number of these facilities. So I too am watching very closely to see what policies will come into place. And there will be a lot of changes, and I think will only be for the better for our residents living in long-term care.
Yeah, there's a great story about the involvement of the private sector in helping manage the scheduling of the data. So again, another example of a business pivoting to help the healthcare system. We did talk about, if the situation continues for a long period of time, some of the measures that need to be taken, but what about our healthcare system? And how do we ensure that it is not burning out the existing healthcare workers, if this goes on for a very long time?
Very good question. I mean, we've heard the numbers of surgeries that have been canceled. We know that there are many, many people waiting for surgery, wanting to come back into the healthcare system. Many of those people probably are waiting to go back to work too, for a hip or a knee or something to be done. And so we want to bring these people back into our healthcare system. We again will need to slowly transform back to a bit of a new normal course of business. Units that have been moved out of acute care, maybe moved back, and looking at how we manage that. BC has been struggling for a very long time in this province with a very low per capita number of nurses, and so we will have to work with the government on how we ensure we have enough nurses and other healthcare practitioners to be able to meet the needs of British Columbians. And that will be something we have to very closely monitor as we scale back up healthcare and manage COVID as it goes, as it overlays in the next months as we move through this. But we will continue to monitor it closely and work with the government and the health authorities. But people do need to remember to take some time, take their breaks, and we will have to figure out this new normal.
I believe I heard the health minister, Adrian Dix, mention thousands of these surgeries had been canceled. What are you hearing about how long that could take to get that backlog taken care of? I mean, this is sounds to me like it would be a prolonged period of time.
Yes, well, we've had a large number of surgeries canceled. I was also pleased to hear that a large number of surgeries also continued, and about 50% of those were unscheduled, meaning people came in for sudden emergent conditions, but 50% of those continue to be scheduled surgeries that were high risk. So we do continue to do the surgeries that are of greatest need to make sure that life and limb are protected, and we'll continue to do that. I know that they will very closely monitor and try to figure out how we can return people back into the healthcare system, which surgeries will need to be done urgently as we start to open up more beds. Again, with the intent that many of these people are working and trying to get back to work, and so we want to support that.
We have time for a couple of more questions, and maybe I'll go down to the bottom here because we did sort of cover a little bit of the two in the middle, but are there different protocols in place then to protect nurses who are caring for different patients? For example, here in the question, long-term care facilities versus the general cases versus ICU. I mean, how does that change now in the time of a pandemic?
A very good question. Yes, there are slightly different parameters. At the end of the day, nurses are professionals. They do follow something that we call which is called the precautionary principle. Because this is a novel coronavirus, as we're evolving and learning more, nurses have to use their education, clinical judgment at the point of care to determine what level of personal protective equipment they require. What's come to light, as we found out, is that there's real struggles to find appropriate levels of personal protective equipment in many of our long-term care facilities. So we do need to address that, and certainly an issue for community. Acute care system seems to be much better supplied, but again, we are in a significant shortage across the province, and managing in a conservation period right now, trying to conserve our current equipment. So nurses do use their professional judgment to determine what's right for them at the point of care, and certainly those who are more clinically ill, requiring aerosolized procedures, ventilation, are at much greater risk. But as this disease evolves and we learn more about it, we may see that we require higher levels of protection in all areas. But right now we leave that to the nurse to make the decision, and we do recommend that they make the decision that's best for their own health and safety and the patients that they're caring for.
And time for one last question. And from a healthcare perspective, Christine, how are we going to progress back to a normal way of life? And normal maybe in quotations, because we don't know what that new normal is going to look like.
Well, I think we're going to learn a lot about this from this pandemic, because I'm not sure it will ever be the first and only pandemic in our lifetime. We've seen other sort of waves, and so we might need to prepare annually for pandemic. So I think from a business perspective, pandemic planning will be more on the forefront for all of us, whether we're in healthcare or in business. We will have to look at how we transition back to bring all of the people who required for surgeries back into the healthcare system. I think there'll be more emphasis on what is the work that public health nurses do, which are really often a silent group of people. When they're very effective, we often don't hear about them, but this time we've heard a lot about them. The amazing work that's been done through 811. So there are a number of areas that we've not paid close attention to that we're really going to have to focus on as we go forward, long-term care being one of them.
Well, definitely called Healthcare Heroes for a reason. And Christine, thank you so much for joining us today. And I'll see you out there at 7 o'clock from your neighborhood to my neighborhood. Thank you.
We'll be there. Thank you so much.
And to watch this webinar again, please visit boardoftrade.com, and the page is called COVID-19. It will be uploaded within the next few hours. And we'd like to continue this important conversation and stay connected. So our series of free webinars on navigating COVID-19 will continue. We're going to bring together experts to speak on a variety of topics, such as financial reporting and audit implications, navigating employment and labor law, and cloud computing. Now, we have also created a business resource page designed to provide information and toolkits to businesses and individuals, and you can find it at boardoftrade.com. This page will be updated as new information becomes available, and we will continue to find and create resources to support you as the situation evolves. Thank you to everyone for being part of today's webinar. We look forward to connecting again soon. Be kind, be calm, be safe.